one of the clinical cases involving ethical issues and my reflections on it. During my clinical posting, I encountered an elderly patient, female, diagnosed with advanced cancer. She was still mentally competent, but her family requested that medical team not disclose the diagnosis to her, fearing it would cause her emotional distress. They also preferred to make the treatment decisions on her behalf. This situation had several ethical issues for me. To begin with, there was a conflict between patient autonomy and family wishes. According to ethical principles, a competent patient has the right to make the decision about her own care. Second, the issue of truth-telling arose, as withholding information could undermine the trust between us as medical practitioners and the patient. Third, there was a tension between beneficence and non-maleficence, whether to protect the patient from distress or to ensure she could make informed decisions. Cultural factors play a huge role in this, as family-centered decision-making is common in some societies. Applying ethical principles, autonomy suggests that the patient should be involved in the decision-making. Beneficence support acting in her best interest, which includes allowing her to plan her care. Non-maleficence remind us to avoid harm, but withholding the truth may cause more harm in the long term. Justice ensures that the patient's rights are respected equally. In managing this case, the appropriate approach was to gently explore the patient's preferences, whether she wanted full disclosure or preferred her family to decide. This respects both autonomy and cultural value. From this case, I learned that ethical dilemmas often involve balancing principles rather than choosing one. Communication is very crucial, and assumptions about what is best for the patient should be avoided. Most importantly, respecting the patient's autonomy does not mean ignoring cultural context, but carefully navigating both. In conclusion, this experience reinforced that ethical practices require not only knowledge, but also empathy, cultural sensitivity, and clinical judgment. That's my take on this case. Thank you.